introduction of the parotid gland. Parotid gland is one of a salivary gland lying in the parotid region of the body. The parotid gland is a paired salivary gland in the here present body. The different salivary gland all of you learn already, like submandibular salivary gland, sublingual salivary gland. These are major salivary glands in the body. But among this major, the peculiarity of parotid salivary gland, that this parotid gland is a largest salivary gland in the body. Along with major salivary glands in the body, there are many of this one is a minor salivary glands. These are also present. The different minor salivary glands which lies in the body, the different minor salivary glands are labial glands which lies in the lip, buccal glands which lies in the buccal mucosa of the oral cavity, von Ebner glands lying in the tongue. These are the examples of the minor salivary glands lying in the body. The function of the salivary glands lying in the body is secretion of the saliva. The saliva in the body consists of enzymes are present. The enzymes like lipases, amylases, such enzymes are present in the saliva. This saliva which is secreted by these salivary glands, it helps to give the lubrication to the oral cavity, and the enzymes which are present in the salivary gland, it helps for the swallowing and digestion of the food. So here in this way, this parotid salivary gland which lies in the body is an example of a largest type of a serous salivary gland in the body, because the structure of the parotid salivary gland that shows the more number of the serous acini as compared to the mucous acini. So the parotid gland is an example of a serous salivary gland in the body. The secretions from the parotid gland is saliva, and the secretion from this parotid gland has drained through parotid duct. This parotid duct is also known as a Stenson's duct. Here in this diagram, here you can see all of you, this is a parotid gland lying in the parotid region, and this is a parotid duct. This parotid duct is also known as Stenson's duct. This parotid duct or Stenson's duct was discovered by an anatomist known as Dutch Nicholson during the year of. Now, introductory part of this one is a parotid gland. Now, regarding about this one is a general and location. This parotid salivary gland is lying in the region known as parotid region, means around the ear. The peculiarity of the parotid salivary gland is a largest type of a serous salivary gland in the body. General features of the parotid gland, this shape of the parotid gland. This parotid gland It possesses the shape like inverted pyramid in the shape. Normally, weight of the parotid gland is about 25 grams in the weight. The weight of the parotid gland, it increases in infective condition known as a parotitis. This parotid gland is a compound tubuloalveolar gland consisting of more number of the serous acini as compared to that of the mucous acini, which are seen in the structure of a parotid gland. All of you seeing that here this is a external acoustic meatus of the external ear. In front of the external acoustic ear, here this is known as a paraotic region, and this orange color is shown for parotid gland in the body, and this is a parotid duct which starts from the middle of the anterior border of the parotid gland. This is known as a parotid duct or Stenson's duct in the body. Now after this, now regarding about this one is a gross anatomical features of this one is a parotid gland. All of you here seeing that different salivary glands which are present in the body. So here this is a parotid salivary gland lying in the paraotic region. Here lower part there is submandibular gland lying in the submandibular fossa. This is a sublingual gland lying in the sublingual fossa of the body. Then regarding about this one is a parotid, regarding about this cell structures which lies in the parotid region. So here in this PPT, the structures which lies in the parotid region, these are shown. So main here there is a presence of a parotid salivary gland. Then from the middle of the anterior border, this is known as a parotid duct or the Stenson's duct. Then here you can see this is a external acoustic meatus. Then here deep to this one is a parotid gland. All of you can see terminal branches of the external carotid artery known as superficial temporal artery. Then after regarding about this one is a location or the site of the parotid gland. This parotid gland lies in the paraotic region. This paraotic region is bounded in the front by the posterior border of ramus of the mandible. Behind the region is bounded by mastoid process and upper part of a sternocleidomastoid or sternomastoid. Below this parotid region is bounded by digastric muscle and stylohead muscle. Above it is bounded by external acoustic meatus and temporomandibular joint. Medially, paraotic region is bounded by styloid process. This is regarding about the boundaries of the parotid region in the body. Now after the location of this one is a parotid gland. Here regarding about the lobes of the parotid gland. The parotid gland consists of the two lobes are present in the parotid gland. The two lobes which lies in the parotid gland are superficial and deep lobes. Deep lobes are present in the gland. In between these two lobes of the parotid gland, there is presence of a facial nerve, and this facial nerve in the body, it gives rise to the different branches arises from the facial nerve. Due to the branching of the facial nerve, here the parotid gland has divided into the superficial and deep lobes in the body. Now after this, here you can see all of you, this one is a in front, here you can, this one is orange color is a parotid gland, here green color is the parotid duct or Stenson's duct, which opens inside the oral cavity near to the crown of second molar tooth, and deep to the parotid gland here, this is a facial nerve which gives rise to the different branches which arises from the deep to the anterior aspect of a parotid gland. So here this one is the branches of the facial nerve which arises deep to the parotid gland are shown in this PPT. Then after this, regarding about the deep lobe of the parotid gland. This deep lobe of this one is a parotid gland. It extends medially through the stylomandibular canal and is formed ventrally by the posterior edge of the ramus of the mandible. Then after lobes of the parotid gland, regarding about the coverings of the parotid gland. In case of the coverings or capsules of the parotid salivary gland, the parotid salivary gland is covered by two coverings or capsules which surrounds to the parotid gland are inner true capsule and outer false capsule. These are two coverings of the parotid gland. The inner layer is formed by the true capsule, while the outer layer is formed by the false capsule of the parotid gland. The inner true capsule is formed by the condensation of the fibrous stroma of the gland, while the outer layer, known as the false capsule of the parotid gland. The false capsule of the parotid gland, also known as the parotid sheath. The false capsule of the parotid gland is derived from the investing layer of the deep cervical fascia, amongst which the superficial lamellae of this false capsule is attached to the lower border of this one is zygomatic arch, while the deep lamellae of this capsule is attached to the styloid process by forming the stylomandibular ligament. This stylomandibular ligament lies between the styloid process and the inner surface of the angle of the mandible. This stylomandibular ligament, it helps for separation of parotid gland and submandibular salivary gland in the body. Now this is regarding about the two coverings or the capsules which surrounds to the parotid gland in the body. Then after this, now after these capsules of the parotid gland, Now regarding external features or presenting parts of the parotid gland. This parotid gland, it possesses the narrower conical apex which faces downward, then broader base which is facing superiorly towards the external acoustic meatus. Then it possesses the three borders like anterior border, posterior border, medial or pharyngeal border. The different surfaces which are present on the parotid gland are superficial or lateral surface, the different surfaces are superior surface or base of the gland, superficial or lateral surface, anteromedial and posteromedial surface. These are the different surfaces which are present on the parotid gland. The apex of the parotid gland is narrower conical facing downward in the body. The different surfaces which are present, on the parotid gland are superficial or lateral surface. This superficial or lateral surface, it is the broad, convex and is covered by skin superficial fascia which consist of the posterior fibers of the platysma. Then it also consists of the dense capsule of the parotid gland. The lateral or superficial surface consists of the few of the parotid lymph nodes. Then twigs of the great auricular nerve and few fibers of the platysma, and also rhizorius muscle extends up to the superficial or lateral surface of a parotid gland. So all of you able to see, this is a superficial. In this PPT, transverse section has taken to the parotid gland which shows the relations. Here superficial surface covered by skin, then platysma, here green colored shown for the parotid lymph nodes, and this is a parotid fascia. This is the relations seen on the superficial surface of a parotid gland. Then after the superficial surface of the parotid gland, now regarding anteromedial surface of the parotid gland. The anteromedial surface of the parotid gland is related to the posterior aspect of the ramus of the mandibular. Then it is related to the posterior inferior part of the masseter muscle, middle pterygoid muscle and its insertion, that is on the lower part of the inner surface of the ramus of the mandible. Then the branches from the facial nerve that runs from the deep aspect of the anteromedial surface of the parotid gland. Then after this anteromedial surface of the parotid, about the posteromedial surface of a parotid gland. The posteromedial surface of the parotid is very large and is come in contact with the many of the structures. The different structures which are related on the posteromedial surface of the parotid gland are the different processes related with the posteromedial surface are mustard process, then styloid process. The mustard process and two muscles attached to it are on the external surface. There is a attachment of a sternocleidomustard. Then posterior belly of the digastric muscle, styloid process, and the structures which are attached to the styloid process, that mainly muscles which are attached to the styloid process like stylohead, styloglossus and stylopharyngeus muscle. So here in this PPT, here you can see this is a mustard process. Then here this is a posterior belly of the digastric. This is a styloid process and this is a posterior belly of the digastric muscle. Then along with internal carotid artery and this internal jugular vein, these are separated from this gland by the styloid apparatus. Then after this surface, now regarding about the borders of the parotid gland. The parotid gland in the body possesses the three borders like anterior border, posterior border and medial or pharyngeal border. The anterior border is thin. The anterior border of the parotid gland rests on the masseter muscle and separates the superficial from anteromedial surface. The different relations from the anterior border of the parotid gland are zygomatic branch of the facial nerve, transverse facial vessels, upper buccal branch of the facial nerve, accessory parotid gland and its duct, parotid duct or Stenson's duct, then lower buccal branch of the facial nerve, marginal mandibular branch of the facial nerve. So here all of you can see in this PPT that here you can see this one is these yellow colored, these are the branches from the facial nerve. So here you can see this is a cervical branch of the facial nerve, then mandibular branch of a facial nerve. Here this one is a buccal, upper buccal and lower buccal branch of the facial nerve. Here this one is a zygomatic and temporal branch of the facial nerve. These yellow colored, these are branches from the facial nerve which runs deep to the anterior border of a parotid gland. After this anterior border of the parotid gland, now regarding the posterior border of a parotid gland. The posterior border of the parotid gland separates the superficial from posteromedial surface. The posterior border, it overlies the sternocleidomustard muscle. After this posterior border, now regarding the medial border of the parotid gland. The medial border of the parotid gland, also known as the pharyngeal border of the parotid gland, because the medial border of the parotid gland. It touches the lateral wall of the oropharynx. So the medial border is also known as pharyngeal border of the parotid gland. Now after this, the surfaces and borders of the parotid gland, the raised parts of the parotid gland, like apex of the parotid gland. The apex of the parotid gland is conical, narrower, facing downward, and the apex lies between the sternocleidomastoid and the angle of the mandible. The apex of the parotid gland overlaps the posterior belly of the digastric muscle. Then, so here in this PPT, all of you can see this is a apex of the parotid gland facing downward. Then apex of the parotid gland. Now regarding the base of the parotid gland. The base of the parotid gland is expanded facing superiorly in the body. The apex faces the base of the parotid gland faces towards the external acoustic meatus of the parotid gland. Now after the base of the parotid gland, now regarding about the structures which passes through the parotid gland. Through this parotid gland, the structures which passes forward in the body, these structures are: one, the facial nerve, which is this facial nerve is also known as the queen of the face. Then the different branches which arises from the facial nerve. Then this yellow colored has shown for the branches which are arising from the facial nerve. Then this one is the blue colored is the this one is the blue colored is the retromandibular vein, which lies deep to this one is the parotid gland. Then red colored has shown for the external carotid artery, then along with few of the parotid lymph nodes. These are the different structures which passes deep to this one is a parotid gland. So here you can see this one is a yellow colored has shown for the facial nerve and its facial nerve and its branches, like this one is a branches like this one is a buccal branch, then this one is a then buccal branch, cervical branch, then this one is a zygomatic branch, and here you can see this one is a external carotid artery and its two terminal branches. Then this one is regarding the structures which passes through this one is the parotid gland. Now the one by one regarding about this one is the structures which passes forward through this one is the parotid gland. First about this one is a facial nerve. This facial nerve is a seventh cranial nerve in the body, and this seventh cranial nerve known as the facial nerve, also known as the queen of the face. The facial nerve is the most superficial structure lying inside the gland. The facial nerve has divides into the two main divisions like temporofacial and cervicofacial. These are the two main divisions which are formed by this one is a facial nerve. The different Overall, the different branches which arises from facial nerve are temporal branch, then zygomatic branch facing towards the zygomatic bone, then towards this one is the buccinator muscle of the face, two buccal branches like upper buccal and lower buccal branch of the facial nerve, then one branch faces towards the cervical region known as the cervical branch of the facial nerve, and a mandibular branch of the facial nerve. These are the different branches which are given by this one is a facial nerve. Overall 6 branches are given by this one is a facial nerve. Then the second structure which pierces to this parotid gland known as the retromandibular vein. So here you can see this is a retromandibular vein. Blue colored is a retromandibular vein. The retromandibular vein consists of the 2 divisions are present in the retromandibular vein. The retromandibular vein, the 2 divisions are the anterior division and posterior division. The anterior division of the retromandibular vein, it fuses. Anterior division is fuses with this one is a facial vein by forming a common facial vein. This is a facial vein. This is the anterior division of the retromandibular vein by forming a common facial vein. Then the posterior division of the retromandibular vein, it fuses with the posterior auricular vein by forming a external jugular vein. This is a external jugular vein which is a superficial vein lying in the cervical region. This is regarding the retromandibular vein and its 2 divisions like anterior and posterior division of the retromandibular vein. Then after this, next structure is known as a external carotid artery. So here you can see this is a external carotid artery. This is one of a branch from the common carotid artery. The external carotid artery deep to this one is a parotid gland get divides by forming the 2 temporal branches known as superficial temporal artery and maxillary artery, amongst which the superficial temporal artery runs the course in the temporal region, and during the course it gives a one of a branch known as a transverse facial artery. Then the another terminal branch known as a maxillary artery which traverses the course inside temporal fossa of the body. Now this is regarding the external carotid artery and its 2 terminal branches. So here all of you able to see external carotid artery and its branches like 2 terminal branches like maxillary artery runs the tortuous course in the infratemporal region, another superficial temporal artery which runs the course in the temporal region, then a branch known as a transverse facial artery which runs the course along with the transverse facial vein deep to the anterior border of a parotid gland. Amongst this, all these structures like facial nerve, retromandibular vein and external carotid artery, this facial nerve in the body, it lies deepest structure in the body. Then after this parotid gland, now regarding about the Parotid faciovenous plane. Now what is Parotid faciovenous plane? Here deep to this one is a parotid gland. The facial nerve, which is a mixed cranial nerve, get divides by forming the different branches like temporal branch, then zygomatic branch, upper buccal branch, lower buccal branch, marginal mandibular branch and cervical branch. These are the different 6 branches which arises from this one is a facial nerve. This branching pattern of this one is a parotid gland. It possesses the goose foot-like appearance. This branching pattern of the parotid gland is known as a pes anserinus. So all of you able to see facial nerve, yellow colored facial nerve, and these are the branches arising from the facial nerve. Among which adjacent to this one is the parotid duct, the upper buccal and lower buccal branch. It lies adjacent to the parotid duct in the body. Now after this, Patez's fascio-venous plane. Now regarding about the extensions of the parotid gland. The different projections from the parotid gland. Then second, downward to the anterior aspect of the sternocleidomastoid. Then around the posterior border of a mandible, superiorly to the inferior margin of the zygomatic arch. These are the extensions of the parotid gland. In this PPT, here the yellow arrow had shown for the extensions from the gland. So one extension is to the mastoid process, then another extension is to the anterior aspect of the sternocleidomastoid. Then one extension towards the posterior border of the mandible. These are the extensions from the parotid gland. Then after these extensions of the parotid gland, now regarding about the accessory processes of the parotid gland. The different accessory processes which are present in the parotid gland are one, facial process, then accessory parotid gland. This accessory parotid gland is present superiorly near to the parotid duct. Then pterygoid process, gland process, and pre and post styloid process, which lies adjacent to the styloid process of the body. Then after this, processes of the parotid gland. Now regarding about the structure of the parotid gland. In case of the structure of the parotid gland, already I have mentioned that this parotid gland is a serous type of a salivary gland, and this gland is a compound tubuloalveolar gland consisting of the more number of the serous acini. These serous acini are lined by the serous mucous cell. So all of you able to see here on the right side, here this is a microscopic structure of a parotid gland showing the more number of the serous acini are present in this one is a parotid gland. Then also few of this one is a duct like intralobular duct, then intercalated duct. Such ducts are present in case of this one is a structure of this one is a parotid gland. The secretions from this one is a serous acini are drained into this one is a drain finally into the parotid duct of the gland. Then after this structure of this one is a parotid gland, now regarding about the parotid duct or the Stenson's duct in the body. The parotid duct was discovered by a anatomist known as Dutch Nicholson during the year 1836. The parotid duct is also known as a Stenson's duct. Normally, the length of the parotid duct is about the 5 centimeters. The parotid duct, it emerges from the middle of the anterior border of the parotid gland. Adjacent to the parotid duct, branches from the facial nerve are present. Adjacent to the parotid duct, upper and lower buccal branch of the facial nerve present. The parotid duct crosses the masseter and it pierces the finally buccinator muscle of the face. During the course of the parotid duct, it emerges from the middle of the anterior border of the parotid gland, then it pierces the parotid, then it pierces the buccal pad of the fat, buccopharyngeal fascia, buccinator muscle and buccal mucosa of the oral cavity. And finally, by piercing these structures in the body, the parotid duct opens inside the vestibule of the mouth at the level of crown of second molar tooth in the body. Here in this PPT, this one is a parotid gland and here this one is the pierce by this one parotid duct. Pharyngeal buccinator face, the structures which are pierced by this green colored parotid duct or Stenson's duct in the body. Here this is a course of the parotid, duct in the body. The clinical examination of this one is a parotid duct and a parotid gland is done with the help of a one radiologic procedure known as a xylogram. With the help of this one is a xylogram, whether there are any stricture is present inside the parotid duct or is there any calculi as deposited inside duct has visualized with the help of the radiological procedure known as a xylogram or also known as a xylography. This or xylogram done with the help of a injection of a contrast medulla which passes through the cannula, and here the interior of the lumen of the parotid duct or Stenson's duct is visualized for deposition of the calculi or any stricture is present in the parotid duct. So here all of you able to see this one is a green colored shown for the parotid duct which opens opposite the crown of the second molar tooth, and the parotid duct pierces this one is the buccinator muscle of the face. Then after this parotid duct, now regarding the relations of the parotid duct. The parotid duct or Stenson's duct is related superiorly with the accessory parotid gland, transverse facial vessels, upper buccal branch of the facial nerve. These are superior relations of the parotid duct. All of you able to see this one is superior relations here. This is a transverse facial artery Then this one is the upper buccal branch of the facial nerve. Then after this, inferior relations of the parotid duct. Inferiorly, the parotid duct related with the lower buccal branch of the facial nerve. Then anterior border of the masseter. These are the inferior relations. In this way, the parotid duct pierces the different structures like buccal pad of the fat, buccopharyngeal fascia, and finally buccinator muscle of the face. Now after this, parotid duct or the Stenson's duct. Now regarding the blood supply of the parotid gland. The parotid gland is supplied by the branches from the external carotid artery. Then the venous drainage from the parotid gland is by tributaries of the external jugular vein. Then about the lymphatic drainage of the parotid gland. Now in case of the lymphatic drainage of the parotid gland has drained into the superficial and deep group of the parotid lymph nodes. The efferent nodes, it drains finally into the jugulodigastric group of the deep cervical nodes. The lymphatic drainage of the parotid gland, the lymph from the parotid gland drains into temple, side of the scalp, then middle ear, upper part of the cheek, parts of the eyelid and orbit. Finally, lymphatic drainage is into the deep cervical nodes. Then after the lymphatic drainage of the parotid gland, now regarding the nerve supply of the parotid gland. The nerve supply of the parotid gland is through the sympathetic, parasympathetic and secretomotor nerve supply. In case of the secretomotor nerve supply to the parotid gland is through the sympathetic and the parasympathetic nerves. This parasympathetic nerve, stimulation of the parasympathetic nerves, it produces the watery secretion. Sympathetic stimulation of the parotid gland, it provides the vasomotor supply to this one is a parotid gland. And the sensory supply to this one is a parotid gland. The sympathetic innervation to this one is a parotid gland is through the postganglionic and preganglionic nerve fibers. The parasympathetic nerve supply to the parotid gland originates from the inferior salivary nucleus. Now here this one is a pathway for parasympathetic nerve supply to the parotid gland as shown in this PPT. So the nerve fibers originates from the inferior salivary nucleus of the medulla oblongata, then towards the tympanic branch of the glossopharyngeal nerve, then from the tympanic branch of the glossopharyngeal nerve to the tympanic plexus, then from the tympanic plexus toward the lesser petrosal nerve, from the lesser petrosal nerve it drains into the otic ganglion, from otic ganglion it drains into the auriculotemporal nerve. This is regarding about the parasympathetic nerve supply to this one is a parotid gland. Then after this one is a sensory nerve supply to this one is a parotid gland. Sensory nerve supply to the parotid gland is supplied through the auriculotemporal nerve. This one is a, but the parotid fascia of this one is a parotid gland is innervated by the of the great auricle. Great auricular velocity posterior border of the sternocleidomastoid at the earth's point. The great auricular nerve passes parallel and superior to the external jugular vein and it supplies to the ear and preauricular region. This is regarding the nerve supply to the parotid gland. Now, after this nerve supply regarding the development of the parotid gland, this parotid gland is ectodermal in the origin. It develops from the buccal epithelium lateral to the angle of the mouth. Then after the development of the parotid gland, now regarding the clinical anatomy of the parotid gland. Now here in case of this one is the clinical anatomy of the parotid gland. First about the infections of the parotid gland. The main causative organisms which causes infection to the parotid gland are Staphylococcus aureus is there. These infections may occur from the mouth via the duct. Due to the infections of the parotid gland, there is inflammation occurs. There is a swelling may be occurs in case of the parotid gland, may be due to the benign or malignant tumors affecting to this one is a parotid gland. Then regarding about the viral parotitis, here the causative organisms are myxoviruses. These myxoviruses get infects to the parotid gland via the bloodstream is there. It affects to the glandular and nervous tissue. The different clinical features of the parotitis are fever, then swelling in the parotid gland, ear pain while chewing and difficulty in the swallowing. Then after this viral parotitis, complications of this one is the mumps. The different complications of the mumps are euphoritis, then orchitis, pancreatitis, meningoencephalitis. These are the complications of the mumps. Then this one is a excision of this one is a excision of the benign tumors of this one is a parotid gland. So while the excision of the benign tumors or the special care has taken by prevent the injuries facial. Then parotid abscess it present as a slight swelling with the redness on the surface of the swelling. During the parotid abscess, there is a pain occurs in the parotic region. These parotid abscess in the body, these are drained by Hilton's method. Here in the Hilton's method, horizontal incision has taken for the drainage of the pus. Then regarding the symptoms of the parotid abscess, there is a constant abnormal or the foul taste, then discomfort or the pain occurs while opening the mouth, then pus maybe occurs inside the mouth, dryness of the mouth, redness or swelling occurs on the face and neck, high fever with the chills. These are the symptoms of the parotid abscess. Parotid abscess. Now regarding about the mixed parotid tumor is. This mixed parotid tumor is a slowly growing tumor without the involvement of facial nerve. Malignant changes of this tumor, these are indicated by pain, rapid growth, fixity of the gland with hardness and involvement of the facial nerve. Here in this mixed of lymph nodes occur. Then cleaning of the parotid gland. Examination of the parotid gland and duct is done with the help of the xylogram. Then parodectomy. Here during the superficial parodectomy, the facial nerve is exposed posteriorly in the space between the bony canal of the acoustic meatus and mastoid process. Then after this, regarding the Frei's syndrome. The Frei's syndrome, also known as a Frei's syndrome, temporal nerve, due to the penetrating injuries to the parotid. Here in Frei's syndrome, damages the auriculotemporal nerve and great auricular nerve in the body. So here, this one is a patient affected with the Frei's syndrome occurs is there. So here in patient, in case of the Frei's syndrome, while swallowing the food, there is a sweating occurs. In case of this one is patients suffering by Frei's syndrome. Then Werthin's tumor. The Werthin's tumor, also known as a papillary cystadenoma. This Werthin's tumor or papillary in here arises from the parotid here. Then regarding manual palpation of the gland. Then here radiographic procedures on this one is a parotid gland. Radiographic procedure on the parotid gland is known as the parotid xylography or xylogram. Here in the parotid xylogram or xylography, the visualization of the parotid duct or Stensen's duct has done for the presence of the calculi or stricture or inflammation of the duct. So here you can see this is a parotid duct is there. Then after regarding the parodectomy, surgical removal of the parotid gland known as a parodectomy is there. Then incisional biopsy for the parotid gland is there. Incisional biopsy mainly tumors, that is a pleomorphic adenoma of the parotid gland is there. Scanning technique for this one is a parotid gland. So for this scanning technique, mainly it is utilized in case of the Werthin's tumor with the help of the radiopaque dye technetium 99 per technetium is used. So this one is all regarding about the gross anatomy of the parotid gland. Thank you.